Hello, my name is Megan Filipowitz, and today I will be discussing type 2 diabetes. This is for my nursing course at Indiana State University with my instructor, Dr. Lucky. The objectives for this PowerPoint will be to determine who is at risk for type 2 diabetes, to define what type 2 diabetes is, list signs and symptoms of diabetes, discover common risk factors for diabetes, list resources for more information about diabetes, and determine treatment for diabetes, and educate on ways to decrease your risk. At this time, if you would please take the pretest in the link to this video. Once you are complete, you can scroll down to the bottom of the page for the test, and the answers will be revealed. After you take the test, you can continue with this presentation. So what is type 2 diabetes? Type 2 diabetes is a disease that involves the digestive system and the blood. So what you eat and that goes through your body and your blood. Insulin is a hormone involved in breaking down sugar. It helps remind your body to store sugar and release it when needed. With type 2 diabetes, the body becomes resistant to insulin and does not function as it should. Because of this, you're prone to high blood sugars, which can have a serious effect on your health. Having high blood sugar for long periods of time, whether you are aware of the situation or not, can lead to serious damage to other organs and parts of your body, and even blindness in your eyes. So what are some signs and symptoms of type 2 diabetes? Frequent urination, meaning you feel like you have to go to the bathroom more often than you think, several times throughout the day. Constant feelings of thirst, whether that be dry mouth or just notice yourself constantly drinking throughout the day more than you would normally. Weight gain, tremors, shakiness and unsteadiness, constant hunger, and fatigue. If you experience any of these signs and symptoms, it's important to schedule an appointment with your primary care provider to discuss these so they can do some tests to determine if you have type 2 diabetes. So what are some risk factors that can increase your possibility of getting type 2 diabetes? First off is genetics. Although type 2 diabetes is more commonly associated with lifestyle choices, such as improper nutrition and lack of exercise. However, recent studies have shown that there may be a genetic implication regarding type 2 diabetes, similar to type 1 diabetes. Another risk factor is being overweight. This is because your body has a tougher time digesting sugars when there is a constant influx of them and is unable to store it in fat cells appropriately and digest it appropriately. Another risk factor is high cholesterol. Similar to being overweight, the body is unable to regulate insulin due to the increasing amounts of carbohydrates and fats stored in the body. Lack of physical activity can also greatly increase your risk of developing type 2 diabetes. Poor nutrition is also another risk factor. If you're digesting too many sugars and fats that are artificial and full of excess sodium, this can lead to the insulin resistance as mentioned. Having gestational diabetes, which is having diabetes during pregnancy, can also be a risk factor for developing type 2 diabetes, as your body had already had an increased insulin resistance with pregnancy. Certain ethnicities also have higher risk of developing type 2 diabetes. This includes Hispanic, African American, American Indian, and more. It is important to determine your risk factors with your healthcare provider if you have any questions or concerns. So what are some diagnostic tests that can help determine if you have type 2 diabetes? First off is checking your blood sugar. This can be done at the doctor's office. It is done with a finger poke, and the blood is dispersed onto a monitor strip that then determines your blood sugar levels. If they are elevated, They may do further tests to determine if you have type 2 diabetes, such as an A1C test. This measures the total blood sugar levels you have had through the past 3 months on average. If it is above 5.7%, you may be considered in having prediabetes. Another test is a urine test. They use the urine to test for sugar in the urine because if you have type 2 diabetes, it is possible that you spill out the excess sugars from your body through your urine. Lastly is an oral glucose tolerance test. Typically, this is done during pregnancy, but it can be done with other individuals as well. This is when you are given a sugary drink, and after you drink it, periodically your blood sugar will be tested, and this will determine how high your blood sugar gets after drinking that drink. If it is elevated above a certain number, this could put you at risk for type 2 diabetes. So what are some treatment options once diagnosed with type 2 diabetes? First of all, your provider may recommend physical activity as well as weight loss. Both of these can greatly help reduce your risk for type 2 diabetes and even help treat type 2 diabetes to the point where you may no longer be diabetic. Proper nutrition is also another treatment. They may have you speak with a dietitian or nutritionist to develop meal plans and shopping lists to help you determine the best proper foods for your diet that will help balance sugars in your body naturally. You may also be treated with insulin or oral medications depending on the severity of the diabetes. And lastly, they may prescribe a glucometer for you, which will help you measure your blood sugar at home. So at this time, you may be asking, what are my resources? Some resources include the CDC website, which is the Center for Disease Control. You can go to the link listed in the presentation, and you'll find a page that has several different links with each part of the diagnosis, treatment, and definitions of type 2 diabetes, including what insulin resistance means. Another website is the American Diabetes Association, and they also have a webpage with resources. These resources include local and regional locations where you can find endocrinologists, which are providers who specialize in diseases such as diabetes. And lastly, I have a website listed called Diatribe. This is a local community support page for people who are diagnosed with type 2 diabetes. There are also resources on this page to help you find places in your community to get more information about diabetes, or even just to reach out to others in your community who have recently been diagnosed with type 2 diabetes. Of course, if you have any more questions, it's important to speak to your primary care provider about your risks for type 2 diabetes and whether or not you should be tested. And that comes to the conclusion of our presentation. I would like to thank you for watching this presentation and following along, as well as continuing to follow along with my other presentations. Here are the resources I used to gather my information about type 2 diabetes. And of course, as always, if you have further questions, it's important to reach out to your primary care provider. They can give you pamphlets and resources to help further your education on type 2 diabetes, as well as do tests and discuss with you your risks. Thank you and have a great day.